Hello and welcome to Dragon Bytes, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees based in Wales. This week we've got another one of our coffee pods, and the focus this time is on developing a career in research. Stacey Harris sat down a few weeks ago with Kate Burke, one of our Welsh Neonatal GRID trainees who has a long established background in research. Listen in as Kate discusses how she initially got involved with research, what she had to do to get started with a PhD, the opportunities that opened up to her because of the PhD she was doing, and the advice she has for all paediatric trainees who are interested in developing their research skills. Anyway, that's enough from me. Let's get started.
Hi, I'm Stacey Harris.
Hi, Stacey.
And I'm going to be hosting today's podcast. I'm joined by Kate Burke. She's an ST8 in Neonatal GRID. She's done a lot of research in the past, which I'm hoping to find a lot about today. So, welcome.
Thank you for having me.
So, Kate, what have you done in the past?
Well, I suppose start at the start. I intercalated in my medical degree. So I did a BSc in psychology, which I really enjoyed, and worked in a group in Cambridge which was looking at sort of epigenetics at the time of infant social behaviours, which was really interesting. So I sort of caught the bug there because I really enjoyed that year, and I hadn't really enjoyed a lot of the rest of my medical degree. So I'd enjoyed that, and then following that I applied for the Academic Foundation programme in North East Thames Foundation School. We have an equivalent in Wales, so the Academic Foundation programme is still going in more or less the same form, and basically what it allows is for 4 months in FY1 and FY2 to be put aside to get involved in a clinical group normally, who have a research interest. So I did a project on hepatitis B. So 2 projects actually, one of which was looking at bone density in hepatitis B, and it was basically a spreadsheet project collating information from lots of different patients who'd been treated with a particular drug, tenofovir, and looking at assessments of their bone fragility, and then inviting them for DEXA scans to sort of complete the data set. And then the second project in the second year was basically looking at the best way to screen for viral hepatitis in high-risk communities in East London. So do you do it via school? Do you do it via mosques? Do you do it via other community groups? And what could you do to increase participation? So 2 quite different projects, but sort of, again, things that interested me because they were proper boots on the ground work. So they were things that involved dealing with patients directly, collecting information, putting things together. The first one involved a lot of statistics, which was completely new to me and something new to learn. The second one involved lots of qualitative sort of data collection, which was something that I had no experience of and had never done before. So again, an opportunity to learn a new skill set. Following that, I applied for paediatric training, and I went to the 7 deanery, and I just did my ST1 to ST3 jobs and really enjoyed them, and I'd enjoyed every job that I did, but really missed having the time put aside to do something that I had ownership of, and sort of around ST3 started to think again, should I think about doing something else? Should I think about a higher degree, a PhD or something else? And at about that time, I'd done an audit on a community paediatric placement about array chromosomal microarray, which was the genetic test that was just becoming available for the investigation of developmental delay. And what we were finding in North Bristol was that we were having a lot of incidental findings, and they're results that are essentially unrelated to the reason for the test. So you do the test, but then you find out that the child is a carrier of the BRCA1 gene and so has a future cancer risk, or you find out that they have another microdeletion which isn't associated with developmental delay but is associated with some other problem that might be of significance to either their health or their reproductive decision making. And I did an audit about how we did consent for chromosomal microarray, and found out that as paediatricians, the process of consent was really highly variable. And it was obvious that doing consent well was really important when these more challenging results could be generated. So I met someone at a conference who said, this would be a really nice PhD. Would you think about a PhD? And at the time, I was thinking about a PhD. So that person was Professor Angus Clark, who's a geneticist in Cardiff. And we essentially developed a project idea together with a view to applying for funding from one of the big grant-given bodies like the MRC or the Wellcome Trust. And at the time that was happening, the Wales Deanery, as it was at the time, now Health Education and Improvement Wales, advertised a job called WCAT, which is the Welsh Clinical Academic Training Scheme. And what that promised to do was to give you 3 years of your NHS salary in order to pursue a PhD, in addition to securing your salary through your run-through training. And I thought that sounds like a great opportunity. Applied, got it, and here we are, sort of, that was in 2011, and so that was 8 years ago. The PhD is now finished, and I then subsequently applied for Neonatal GRID.
Oh wow, what a journey!
So that's the story.
Wow, that's amazing. So you did your PhD, and how did you find it?
So I would say that it's not for the faint of heart. It was much harder work than I expected. I think that most of us at some stage in our careers will have some sort of involvement in part of a research project, be that recruiting someone for a clinical trial that's already up and running, or taking something like an audit or a QI project and adding in a research element by doing questionnaires or whatever else. I think what I wasn't prepared for with the PhD was just the scope of what you have to achieve in terms of developing a project idea to a point where it's entirely workable, taking it through the ethics process, taking it through the NHS R&D project, and then actually getting it up and running on the shop floor. It's sort of an extremely time-consuming and bureaucratic process that I certainly had absolutely no insight into before I started, when I'd really only worked on other people's projects. That being said, it was just such a great opportunity to actually get your teeth into something, and I think we've all had that feeling in paediatric training where you just feel like you're on a treadmill and you're just going through the motions every day of coming in, doing your work, completing your e-portfolio, getting home and repeating the same process again. And this was an opportunity to just do something that was absolutely, completely and utterly different, and it was wonderful. And it certainly, although being very challenging at times, has reinvigorated my passion for what we do. I think stepping away from it and doing something else makes you realise actually what a wonderful and privileged job we get to do, albeit incredibly challenging at times. But I think sometimes you realise that certainly the thought for me was that the grass might be greener in academia, and there are certain things which are different and better, but there are also things that are extremely challenging as well.
So you said that you really liked having your boots on the ground, having a project which you spoke to patients. Did you manage to do that in your PhD at all?
Yeah, so the PhD sort of had two arms, one of which was essentially analysing clinically available data in a different way, so looking through how many of our chromosomal microarray results generate variants of uncertain significance, or these incidental findings that we talked about. And the second of which was recording paediatricians talking to parents about chromosomal microarray, interviewing clinicians about their experience of using the test, and then interviewing families about their experience of having the test in the newborn intensive care unit. So there were two sort of contrasting elements again, or one of which was a quants project, essentially was number crunching and stats and looking at proportions and so on. The other of which was just a really human type of work where you get to sort of look at what we do in medicine through a completely different lens, and that was really, for me, very eye-opening and very interesting. And I think something, as an aside, something we don't do enough as we get further on in our training is take time to watch how other people do things. And it's wonderful to do it at that stage, because you sort of have more of a sense then about the things that you value in your communication and the way you work with families and parents. And it was, collecting the data was actually a really privileged opportunity to refine and think about how we do what we do every day.
Yeah, so I was recently in a community clinic and someone did actually do a consent for a genetic test, and it was really good to hear exactly what she did, and I think I'd like to take lots of that away. But yeah, that's just an aside point, really.
Yeah, I think we don't. What's interesting in a single hospital or in a single health system is there are things that get done in lots of different places, such as consent for chromosomal microarray, and in every place that it's done, it will be done slightly differently. So the geneticists will develop their own culture around consent and their own processes, be it with a form or whatever else. The paediatricians and the neonatologists might develop different or similar forms of the same process. In cancer and oncology, they might develop something that looks completely different, and it's really interesting to see how like clinical communities sort of develop their own processes. And that was certainly something that I hadn't really appreciated, is how much of what we do in medicine is defined by the cultures around the departments or units or specialties that we work in.
What else did you get out of your
Best thing I got out of it was travel. So I did a lot of really lovely travelling. So spent time abroad in genetics labs and neonatal units in Nijmegen in the Netherlands, and then in Aalborg in Denmark. Travelled to conferences, all over Europe, America, Australia. So, fantastic opportunities to just go and see new places and meet new people. I met a fantastic and interesting network of people working on similar things, and was able to contribute a new voice to that community, because lots of the people were geneticists or bioethicists or sociologists, and actually there weren't an enormous number of paediatricians being involved in that conversation, even though probably we do the vast majority of mainstream genetic tests that go on in healthcare. So it was interesting to be able to add to that conversation. Certainly got a sense of confidence out of it, and the opportunity to develop my own interest as someone who isn't just trying to tick boxes in a portfolio and move forward from year to year, but something that I can confidently speak about, know about, and know that I can contribute something valuable to. I got out on nights and weekends for a few years, which was part of the motivation for doing it. I wanted to have a break from shift work, and that was great. And probably lots of other things that I can't think about or can't remember, but certainly it's developed me on more levels than just a clinical one, in a way that I certainly didn't anticipate before it all happened.
So I've not even really considered research, and you're selling it to me already.
Yeah, I think everyone should have a go. And I think that the brilliant thing about research in medicine is it sort of makes me quite sad when you hear people say, I've not done research before. We've all done research. So every clinical job has research in it. Even if you just go away and review the literature on a particular clinical decision, is this the right time to start steroids for this baby? Are there any interventions for this child that might be useful, that might help? We've all asked those questions, and we've all addressed them using the resources that are available to us through other people's research, and that in itself is an exercise in research, on an individual level. Most of us have participated in other people's research, either as participants when people are studying the behaviours of doctors and nurses or health systems, or because we've recruited patients to trials that are already up and running. And I think that's a really lovely way to access, sort of on a entry level, essentially, what's involved in doing research, being involved in consent, being involved in the correct documentation, being involved in the procedures or the data collection that the study needs. And what's great about involvement in research is it's entirely scalable. You can do as much or as little as you want. So I would say what I did was probably at one end of the extreme, in that, you develop your own project from scratch and you think about something and you get it going. But then there's also opportunities where a clinical group or a research group advertise a position that's a PhD, where the project is already fully developed, but in an area that you're interested in, and rather than develop the project yourself from scratch, you just apply to the post and take up the project. So I've got some friends who are, doing, my best friend is doing a PhD that was advertised in the molecular genetics of congenital abnormalities of the kidney and renal tract. That was all set up. All she did was, essentially turn up on day one, sit down and start to learn and start to do. And that's another opportunity. There's a whole spectrum of opportunities. The WCAT scheme offers both opportunities in Wales, and there are equivalent schemes in England and Scotland that I know of, supported through the NIHR in England and through Edinburgh University in Scotland. So there are lots of opportunities, and the opportunities are really scalable to the level of involvement that you want to have, and that's brilliant.
So for me, who feels like I haven't really done very much research, but perhaps I have actually, what would your sort of recommendations be to me to how can I get more involved?
I think that participation in clinical governance is always a great entry point for people. So how can you make your audit or your quality improvement project or your service evaluation have a research element? So most of them very easily can sort of tip the balance from just straight clinical governance to something more akin to research. Can you gather data in your unit that might inform a quality improvement project? That's research. Can you look at a problem in a new way? That's research. Can you visit other units, see what they're doing and implement new systems in your own unit? That's sort of right on the QI research boundary. So there are lots of ways to start to get involved. In Wales, there are fantastic opportunities available through the team that do the child protection systematic reviews at Cardiff University. So there are opportunities that can be relatively short-lived in terms of being a reviewer of papers for their systematic review, for their meta-analyses, which is, a lovely way to start dipping your toe in the water of how do we do good critical appraisal that ultimately contributes to new knowledge. They're both nice ways to do things. Also, encouraging the units that we work in to participate in national trials. So, for neonatology, it's the National Perinatal Epidemiology Unit based in Oxford who run lots of trials. And, if you put your hand up and said, hey, I really think our unit should participate in this trial on feeding or this trial on positions for lumbar punctures, I don't think it would be a hard press for you to find a consultant who would support you in, doing that and in becoming involved. So encouraging our units to participate in trials that are already up and going is one way. The other way is if you do something that you could, like my project emerged from an audit. If you do something and there are questions left to be asked, then ask them, and look for ways in which they could possibly be addressed. And one of the things that's tricky with research is finding a willing supervisor and someone who is both pragmatic and realistic and encouraging. But who will have your back in terms of supporting you with funding applications, ethics applications and so on, and that can be really tricky. So if you have an idea, move in the right circles, go to the right meetings, present your work that you've already done and say to people, is there anyone out here who's interested in this? Is there anyone out here who has something to contribute? One of the tricky things with academia is everything isn't in every place. So, I moved to Cardiff to work with Angus Clark. That was sort of, that was the price of admission for doing this project. And so that is tricky when people have other commitments. That means it's not so easy to move around, but there will always be opportunities to participate. And the question is not, should I participate, but how far should I take this for myself?
And so are there any courses or ways to get a bit better at doing statistics that you can recommend?
Well, I think good clinical practice is now one of the mandatory courses for ARCP. So I think everyone ought to be doing that as part of their general training. In Cardiff, there's a stats course which runs, I think, every February, March time, run by Mali Chakraborty, who's one of the neonatal consultants at UHW, which is a fantastic course. But there are equivalent courses all over the place, particularly Bristol in the School of Community Medicine. They run an enormous number of courses, which Welsh trainees are eligible for a lower price on because of the GW4 partnership, which is a partnership between Cardiff University, Bristol, Bath and Exeter, and they run a course on stats, on qualitative methods, on data collection, lots of wonderful courses. The RCPCH and the NIHR, which is the National Institute of Health Research, normally run a sort of research in paediatrics day, which I think is held once a year, normally just in the early summer, and that's always a great day to go and talk and think about how to develop project ideas, how to network, how to meet people. In Wales, we've got a fantastic resource in REN, the Welsh Research Education Network, who have just continued to churn out loads of really good training and project ideas for trainees to get involved in, and I know that some of those projects have led to, although started off under the veil of QI, have led to, you know, research being generated and new knowledge being brought forward, which is fantastic. So I think, yeah, it's about sort of identifying what's available locally and then really making the most of the networks and groups that you can be a part of. And we're really fortunate in Wales in that we seem to have loads of resources available to us.
Yeah, there's so many things that I hadn't even really considered there. Brilliant. So is there anything else that you kind of had thought about that we hadn't really covered?
So I think funding is one of the things that people come back to again, and you've got one of the things we need to think about is, as medics, is that we actually earn quite a high salary, and so the funding requirements for a project that we would be involved in, it's often significantly more costly than employing a post-MSc student from another healthcare discipline. That being said, there are lots of entry-level grants for medical professionals available through Wellcome, through the NIHR, also through lots of the charities associated with children's health, like, I can't remember the specific names, but there are certainly awards for cardiology, renal medicine, childhood disabilities. So there are lots of charities that also put together funding for clinicians to undertake research. So, but it's often quite difficult to navigate those things on your own. So I would really encourage people to sort of find a friend who can really help you to think about the sources of funding that might be available to you. The other thing I really want to stress is that you don't have to do a PhD. A PhD is a big commitment, a 3-year undertaking, you know, registering with a university, producing work, producing papers, participating in group research, and that's tricky, but you know, there's loads of opportunities to just do a 1-year project where you could generate a couple of papers and do something that was relatively standalone, but really does go quite a long way to develop your own interest. Thinking of Asim's stuff on Burns, you know, like, it wasn't a 3-year undertaking, but he's generated a fantastic piece of work by looking at that data which was already available. So there are opportunities that are also shorter term, but you know, that will just be equally as fruitful as a PhD and might give you an opportunity to sort of dip your toe in the water and see if that type of work is something you would be interested in.
Yeah, and what did Asim do? He did a ST3 post, wasn't it, that was, didn't he?
I think that it was like a post that was designated for either education or research, and I think those posts are now becoming more and more common. I think an important thing to also mention is research in medical education, which seems to be its own field, and you know, how important that we contribute to what constitutes effective medical education, and that's obviously an easy in for lots of doctors because it's something we'll all have experienced and know a reasonable amount about. And I'm sure that, well, we're already seeing lots of posts coming through with MedEd as part of the job title, and I'm sure that'll only continue to grow. So, you know, even though it's titled MedEd, there may well be an opportunity to do research in those posts.
Yeah, so we were talking about MedEd research yesterday, and it was again something that I'd not even really considered before. So yeah, that might be a really good thing to start off with. Yeah. Thank you so much, Kate, for joining me today. I've learned loads, and I hope it inspires lots of doctors and other healthcare professionals to do research.
And if people want to get in touch for more specific information about research, or if there are things I can help with for trainees locally in Wales, please don't hesitate to get in touch.
Oh, that's very kind of you. Okay, thanks.
What an incredibly inspiring person Kate is. She makes it sound so easy. It makes me proud to be working in Wales alongside all these colleagues who are just like her. Anyway, if you're interested in contacting Kate, you can find her on Twitter at Dr. K Neely, so that's DRKNEELY. Otherwise, you can contact either myself or Stacey and we can put you through to her. Join us again next week for an episode on the abdominal examination with our resident clinical exam guru, Sophie Constantinou. That's all for this week. Thank you for listening to Dragon Bytes.